Good afternoon. Happy spring. I'm so excited to be back doing COVID-19, Black Cambridge and COVID-19 with Councilor Denise Simmons. We took a little hiatus, but spring is here and we said, you know what, it's time to get back at it and talk about some of the really challenging issues that our community is still facing in the context of this global pandemic that we're all living through. So welcome. Thank you for joining us today. We are really elated to have a much needed conversation about this vaccine. The last time we were convened together for this program, we were not at the point where there was an actual vaccine, and now we have one. So we're going to go into depth around what are the things we need to know about this vaccine and answer some of the questions that people in the community are asking as it relates to how to think about this vaccine as we all try to figure out how to live in this pandemic. But before we get started, of course, I need to turn it over to my dear friend, Councilor Denise Simmons, who has been doing this with me from the beginning of the pandemic. Denise, what are you thinking today? Are you happy it's spring? We're back at it. What's happening in your world since the last time we've seen each other?
Well, first of all, hello, everyone. Good afternoon, and it's great to be with you. To my co-convener and vice chair of the school committee, Manikka, I'm always happy when it gets warm. I always tell friends of mine that want to come visit, oh, I love to come to Massachusetts. I said, well, remember, we only have 2 seasons, winter and July. So anytime it gets warm, I'm my best self. But good afternoon, everyone. It's so good to be here. It seems as though we've not been able to be together in such a long time. So I'm excited to have this conversation. This is going to be our 13th episode of COVID-19 and the Black community, launched not too long ago by my good friend and again a co-conspirator, as we get into, in the words of the former congressman, as we get into good trouble, talking about the issues that are important. So today we're doing it again, getting into some good trouble to talk about an issue that's so important to our community, which is this upcoming vaccine in the context of COVID-19. But before we do any of that, I just want to acknowledge CCTV. Thank you for always being there to support us. And we have our people that you don't get to see, Maritza Grooms and Sean Eiffel, Neil Alpert. And we also want to acknowledge the brand new director, Jessica Smizer, who's taken over after the former ED who had been with us for a number of years. But we're at the tail end of International Women's Month. And as a part of honoring that, we want to bring these formidable women forward to have a conversation to you about the vaccine. Now, why would we choose women? Women are the women of the people in our families, very often, not completely, but very often, that carry the message, gives the knowledge, talks to the community. So these formidable women that you see before you on screen this afternoon are going to share their knowledge, fact, fiction, myth, and what people sort of come up with to talk to you about what is really going on around the vaccine and what you really need to know. So Sister Manikka, Vice Chair and co-convener, I'm so pleased to be here. I'm going to turn it back to you so we can get started.
Well, let's get to it. Okay, let's get to this dynamic panel that I'm so excited that's joining us today. I'm going to allow them to introduce themselves and give us like a 1 minute, 2 minute overview of who you are, the organizations you're associated with, and the work that you do. So I'm going to start off with Dr. Holmes. Dr. Holmes, tell us a little bit about yourself.
Good afternoon, everyone. My name is Michelle Holmes. I originally trained as a primary care internal medicine physician. I started my career at the Cambridge Health Alliance in one of the neighborhood health centers. And then several years ago, I became an epidemiologist. And it's funny because until this past year, no one knew what an epidemiologist was. Now everyone knows what that is. It's been a very busy year for me. I've done quite a lot of advising of various community organizations on COVID preparedness and safety, and I'm really pleased to be able to speak to this group today. Thank you.
Thank you. Ms. Rose-Tynes, tell us a little bit about yourself.
Hello, hello. My name is Tracy Rose-Tynes, and I am the Associate Chief of Clinical Services for the Cambridge Public Health Department, and I'm also the Interim Nurse Manager for School Health Services. I have been working for the Cambridge Health Alliance for 28 years now, and since the pandemic, I have been wearing two hats, one as the Associate Chief and one as the School Health Nurse Manager. So I've been sort of juggling both roles during this time, and it's been a great deal of work, but I have to say the work has been energizing. We have so many partners in the community. Our goal is to keep the community as safe as we possibly can. So whether I'm doing work specifically in the schools or doing work in the community, it's just been an incredible time. The pandemic, none of us were prepared for this. It's all of us collectively, our first pandemic, and we are doing the best that we can right now to just keep the community safe.
And, before I go to Dr. Khan, let me just say, I am so grateful for your leadership in our school district. You keep us safe. And I want the public to know that you start your day oftentimes at 6 o'clock in the morning, going through data to see how our community, our school community has been impacted by COVID and reading those test results to ensure that there is no spread within our schools. So thank you for that work. And I just wanted the public to understand your role, particularly in the context of ensuring we have safety in the Cambridge public schools. Dr. Khan, please tell us a little bit about yourself.
Hi, everyone. Thank you, Vice Chair Bowman and Councilor Simmons for having me. My name is Alisa Khan. I'm a pediatrician at Boston Children's Hospital and a researcher. I study in my kind of day job how to engage families in better communication and safety in the hospital and kind of how language plays into that. As far as COVID, I have been involved in the Health and Safety Committee with the Cambridge Public Schools, and then I have been involved at Boston Children's on our hospitalists task force on COVID-19. And hospitalists are just pediatricians that care for children who are admitted to the hospital. And then I have two kids in the Cambridge Public Schools. I have a first grader and a junior kindergartner, and I'm really happy to be here. So thanks for having me.
And we're excited to have you here today. So let's jump right into it. Our first question, what are the things we need to know about this vaccine? I'm going to start with you, Dr. Holmes. A lot of people have varying degrees of trust, understanding about how it was developed. It rushed to the market. So there's just a lot of conversations around this vaccine. What are the facts and what are the things that we need to know?
Sure. And I'm going to confine my remarks to the three vaccines that are currently authorized for use in the United States. So those three vaccines are made by, one is made by the company Pfizer, one is made by the company Moderna, and one is made by Johnson & Johnson. And the Pfizer and the Moderna vaccine are very, very similar to each other. They use a new technology, which and it's the first time that vaccines have used this technology. So it's a little, some people have found that to be a little bit scary. However, the technology has been studied for at least a decade. So it's not, it's new in its use. It's not new in its being studied. The Johnson & Johnson vaccine uses an older technology, which has been around for a while and has been used in a bunch of other vaccines. People are often surprised, and we should all be surprised and actually grateful at how fast these were developed. And I want to say that they came into use very quickly, not because any of my study that any corners were cut. One of the problems with vaccines is that they're difficult to develop because there's a lot of, for the pharmaceutical companies, there's actually a lot of financial risk. And one of the things that our government did right is to remove the financial risk from the pharmaceutical companies that allowed them to be able to put it out more quickly than in previous, older vaccines that we know about. So they were studied the way vaccines are always studied. They were, to my reading, the trials that studied the safety and the efficacy of these 3 vaccines were well done. They were thorough. They included a wide variety of people of different ages and different backgrounds, different ethnicities and racial backgrounds. And they were found to be safe. Of course, when you do these studies, the safety is, they studied over a period of, say, 3 months. Okay, so we know how safe they are for 3 months. Given that the pandemic was raging and killing many people, the government allowed them to be what's called emergency use authorization. So they're being used. They're not fully licensed, but they're being used because it's considered an emergency. And I think the information that we have now is that all 3 vaccines are very safe and very effective.
It's interesting. You said that one thing our government did right. We're all so traumatized by the last administration. It's hard to even fathom that something was done right. But you know what? Sometimes you have to give credit where credit is due. So I'll give credit where credit is due from that vantage point. But Dr. Khan, tell us, what are some of the things we should be thinking about this vaccine in the context of where you sit in your work at Children's Hospital?
So in the context of kind of the pediatric community, the Pfizer vaccine is approved for 16 years old and up. So teenagers soon will be able to get that. So that's exciting. And I would definitely encourage when it becomes available for the general public for 16 and 17-year-olds and up to get vaccinated. The other piece is that for younger kids, the vaccine hasn't yet been approved, so there's going to take some time before they are available. And I'll talk about that in a moment. But I think the best thing we can do to protect children and other vulnerable folks is to get as many people in society vaccinated, because it helps protect those who can't yet get vaccinated, for instance, younger kids. That being said, there are trials going on. Moderna just started a trial starting at 6 months old and up. So the younger kids and infants are now being studied. And I know that others have had trials for kind of the older school-aged kids in the 12 to 16, 12 to 17-year age range. And the reason that we need specific trials for kids is because sometimes because kids weigh less and their body metabolizes things differently, sometimes they need a lower dose of the vaccine. So a lot of the vaccine trials are around figuring out, A, that it's still safe for kids, which we very much think it will be, but B, what's the exact right dose that we need. So for instance, the flu vaccine, the dose for an older kid versus a baby is different. And so you need a trial to do that. So the American Academy of Pediatrics is really advocating for kids to be studied and for us to expedite and hasten the access of vaccines to kids. So we're looking forward to that, and hopefully progress is being made in that front.
Well, now that we're talking about kids and the vaccine, I'm going to throw in this question before I go to Ms. Rose-Tynes. But I was really excited yesterday. I read this article about lactating mothers and pregnant women being able to give some form of protection to their children. So, most people know that I gave birth during the pandemic. Lord help me. And I am still a nursing mom a year into this. And it gave me great joy to know that since I made a choice, it was a hard choice because there was no research there regarding it. But I made the choice to get the vaccine knowing I was still nursing. But can you tell us a little bit about that study? I know it's really new, but any insights you have as it relates to nursing moms and pregnant women in the context of this vaccine?
Yes, absolutely. So oftentimes when it comes to drugs being studied or certainly, vaccines, they tend to exclude nursing moms or pregnant women from that just for a variety of reasons. But it doesn't mean that things aren't actually safe for them. It just means they often haven't been studied. That being said, people in the trial some people got pregnant while they were part of the trial, or some people were pregnant and didn't know it. So certainly we have some of that data from people being kind of incidentally pregnant during the trials. But Vice Chair Bowman, what you're alluding to is exactly right. One of the amazing benefits of breastfeeding is that you can pass on these antibodies to your baby. And the antibodies are basically these proteins that your body uses to fight various infections. And so COVID is one of those. And so there's increasing evidence that just like other vaccines and kind of other antibodies, that antibodies that you get from taking the COVID vaccine, which basically allows your immune system to kind of fight against COVID better, those can be transmitted potentially through breast milk and also through kind of the placenta for pregnant women to babies. And so that provides some protection for babies that are too young to be vaccinated. And I agree that is something that's really reassuring. Anecdotally, I can tell you that some of my colleagues, some of my physician mom colleagues who are nursing, many of them are really eager to, and many of them have gotten the vaccine for exactly that reason. And some of them have actually done these little experiments in their offices where they've taken their breast milk and actually tested it on some of those like rapid antibody tests that you can get for COVID, which I think is so cool. And they've seen that when they put their breast milk in that test, it turns positive, which means their breast milk has that antibody to COVID, and that antibody allows us to fight the virus, which is amazing. So I thought that was just great. Every time I would see, colleagues share pictures of their kind of home office tests about breastfeeding. So just one of the amazing things about breastfeeding. And then one more anecdote, and then I'll stop. I had a friend and colleague who, unfortunately, her older child and her husband actually got COVID, and they're all recovered now, so doing well. But interestingly, the two of them got COVID. She, as someone who had been fully vaccinated, and her breastfeeding infant did not get COVID. So they were the two people in the household who didn't get it. The husband did. The partner did, and the older child did. And I think it's just kind of a great anecdotal example of kind of the power of that vaccine and the power of breastfeeding and breast milk antibodies. So
I'm a huge advocate for breastfeeding and encouraging others to do so. If you need anyone to sign up for any of those tests for lactating moms, my daughter's on a ticking time now. It's winding down. So if you need someone, move fast and reach out to me. But Tracy, can you tell us a little bit about what does it look like here in Cambridge as it relates to the vaccine and who has access to it, and what you're seeing as it relates to who's signing up for it?
Well, the good news is hot off the press. So we have about 21% of Cambridge residents who are who have received at least one dose of vaccine, and we have 13% of residents who are fully vaccinated. So just to break those into numbers, so in Cambridge we have about 111,000 residents. So that those who have received one dose, it's about 24,000 people in Cambridge, which is awesome. And it's about 14,000 people who are fully vaccinated. So although I know that there is vaccine hesitancy out there, I think that just in my own asking people just out of curiosity, and it's a touchy thing. It's almost like asking someone, well, who are you voting for? It's like, for some people, it's very personal. So I'm trying to be careful about that. But most people want to move forward and get the vaccine. I think the word is out. I think all of the messaging that's out has really helped people. I know I've done other panels strictly on vaccine hesitancy and just kind of sharing my own story, how I got to be fully vaccinated. It wasn't, boom, I'm going to go get vaccinated. I had to do some research, and I would always share, I am a public health employee, but I'm human as well. So for me, sharing my story, how I got there, it has definitely helped. People need to hear other people's stories, or if it's someone that they trust, they're more willing to take that step. So I think that the more we can get these panels out and the more we can message and help, especially communities of color who have a great deal of mistrust, I think it's the one thing that's going to help. I mean, when you're hearing from people of color, I'm not going to be a guinea pig, I want to wait and see what happens to other people first before I take the vaccine, or even I'd rather just get COVID and see what happens. Those are the people you really, really need to take by the hand. And maybe it means you have 5 conversations with them just to get them to cross over, because we know vaccines and everything that we want to communicate. Vaccines equal prevention. Vaccines save lives. And we're at a point now where it's like life or death, for some people, or severe illness or hospitalization. So if we can continue doing just what we're doing today, and when we're at the grocery store or at the park, and we can just keep educating, I think it's going to make all of the difference. But Cambridge is in a good spot. And I also have to add, it has been difficult to get the state to just hand over vaccine. I know in the health department, we are eager to vaccinate, but so much of that relies on the allotment that we're getting from the state. I know that for one, I was just so excited at the thought of vaccinating all of the Cambridge Public School District. I wanted to vaccinate them. We have a team, we were ready to go, we have the location. It was all about waiting for the state to turn over vaccines. So at this point, I am happy to report lots of teachers, lots of staff. I mean, we're right now in that category where school personnel can get vaccinated. So many have started the process, so many have appointments. So in all of these categories, we're definitely moving forward in Cambridge, and it's very exciting.
Yeah, and I just want to acknowledge for the limited number of vaccines we do have for our Cambridge School District. I just want to commend you, Public Health Department, as well as the leadership at the Cambridge Public Schools, because what we did was prioritize those individuals that have been on the front line of the pandemic from the very beginning. And so, those were our food service workers. They never left the building. Our janitors, then they never left the building. And so, when we talk about equity as it relates to the distribution of vaccines, I appreciate very much so that we centered those individuals that literally never left the building. And quite frankly, that population within our school system tends to be higher when it comes to people of color. But when we talk about this conversation around trust, I want to get into this conversation that the community is having around the effectiveness of the various vaccines. Can you just talk to us about that? And I know I'm guilty. When I saw the initial findings from Moderna and Pfizer when they came out, I'm like, oh, I need that vaccine. But can you talk a little bit about why that may not be the right way to think about it? I'm going to start with Dr. Holmes. Can you just give us some insights on that?
Yes, I'd be happy to talk about that. So people remember that the Pfizer and the Moderna vaccine were authorized first. So the trials that studied them happened several months ago. And they were studied when we had just one strain of the vaccine that was circulating, and that was the original strain, which originated in Wuhan, China. And those vaccines were shown to be about 95% effective against that strain. So the later Johnson & Johnson vaccine was studied later, and it was studied when there were these variants, these mutations that you've been hearing about circulating. These mutations have been more, they're more virulent, and they're more infectious, and they may be more deadly. The Johnson & Johnson vaccine was studied while those were circulating, and in particular in places where that was circulating, in particular in South Africa. And I have to tell you, I have colleagues in South Africa that I was working on a project in December and January, and I would be on Zoom with them once a week, and hearing what was going on in that country was terrifying, because that is a scary variant. So the Johnson & Johnson vaccine showed up as about 70% effective. You can't compare them one to one. It's like comparing apples to oranges. I believe that if you were to study Pfizer and Moderna again now with these variants, they too would be 70% effective. Okay. So, and if you had studied Johnson and Johnson back, 6 months ago, it probably would have been 95% effective. I can't know that for certain, but all the indications seem to show that. So I think they're probably about effective, the similar in effectiveness. And Johnson & Johnson has certain advantages. It's one shot. And I have to tell you, I have family members. I have my children are all essential workers in various states, and they're eligible for vaccination. And I have a couple of them, they were kind of reluctant. I said, as soon as Johnson came out, I said, you should go get that one. And they said, okay, we're going to do it because it's one and done. And they did. So I'm really happy. I'm grateful for that. So there's that advantage. It's also easier to store and so forth. And I can see how people could look at those numbers and say, wow, I don't want to get that one because it looks like it's worse, and and it's easier to store. So they're going to roll it out to the rural areas and the communities of color, and they're going to say, oh, we're getting the worst one. But you can't compare them like that.
No, I really appreciate that. And I think knowledge is power, and being able to explain that to people so they'll have a better perception or a different perception about the effectiveness rate of these is just really important. And so, Ms. Tynes, can you just tell us a little bit about, have you had any experiences with this whole conversation around vaccine shopping and why that is or is not a good thing to do, particularly in the context of how the vaccines are distributed across the Commonwealth?
Yes, well, at this point, I always say, the fact that Dr. Fauci has said, get what you can. So, I think we all trust in Dr. Fauci. So people get a chuckle out of that. But right now, it's not as if we can even pick and choose. If you want the vaccine, it's been tricky to get appointments, but whatever you can get, take it. I mean, I can't stress it enough. It's, when you get your vaccine, the three of them, what do we want? We want to prevent severe illness. We want to stay out of the hospital. We want to live. We don't want to die. So for those three things alone, these three vaccines will prevent those things from happening. So I always try to educate people on those lines. And just once you get an appointment, get what you can get. To be able to say, well, I want the Pfizer. Well, you might wait 3 months for that appointment to come up to get the Pfizer vaccine. And you don't want to wait around because honestly, the COVID virus, you can pick it up anywhere. I've had people who have been so careful, people who have almost been paranoid to leave their homes. They're picking up the COVID virus. And it's like, we can't prevent that from happening. Why not prevent the disease by getting the vaccine that you can get on your next appointment, whatever's offered? They're all going to provide protection from the virus. And that's what we need.
Let me just jump in there for a moment, because you took one of the questions that had come into my chat, which was, can you vaccine shop? Some people believe, and Dr. Holmes, you spoke to this a little bit, well, J&J late to the party, or they did something back a couple of years ago, and I think I'm going to take the Pfizer because my friend said it was better. And anyone can speak to this, but Tracy, Associate Chief Rose-Tynes, you had just said you have to go where you can get it. I think there's some belief, though, that you can be told something. Someone says, well, I had the Pfizer and it was just wonderful. And then you can just go shop and get the Pfizer vaccine. Could anyone just kind of drive that home, how real that is? Can you go and find an appointment for a specific vaccine?
I suppose that is not out of the question because the 3 vaccines are being offered all over the state right now. So I suppose you could vaccine shop if you had your heart set on that. But I would just caution people against waiting to be vaccinated to shop for that one specific vaccine that you want, because that could be a critical time between shopping and actually getting the virus.
Excellent, excellent. And the other question that came out was, and either Dr. Khan or Dr. Holmes want to go back to the earlier question about vaccine shopping, please do. But people wanted to also know, well, now that I've got this vaccine, I can throw off my mask, I can get closer to people. What would you recommend? Because the other thing is, I feel like folks are thinking it's the magic bullet or it's this force field that wraps around you. So there've been a couple of conversations around that. Could you address that for us? Once you have the vaccine, what should you do or not do? I just throw that's open to anyone.
I don't mind taking a shot at that, and others can chime in too. So I think the CDC came out with some recommendations for vaccinated people, and I think they're very kind of appropriately cautious. I plan to follow that myself because I haven't got my vaccine. And it says that vaccinated people at 2 weeks after your last vaccine can associate in small groups with other vaccinated people and can associate with non-vaccinated people as long as those non-vaccinated people are low risk. So no, don't go visit your grandma with cancer, right? But if people are, young and healthy and don't have, risk-giving diseases, you can, in small groups, you can associate with them. It says to avoid large groups and to avoid large gatherings. Now, you will notice that is contrary to what is happening in society, right? Everything's opening up. You can go to weddings and concerts and everything. That's not what the CDC is recommending. That's not what public health people are recommending. And I'll tell you, that's not what I'm going to do. I am going to associate in small groups. I'm looking forward to Easter dinner with one of my good friends who I have not seen for a year. So that's my recommendation.
Dr. Khan, do you want to add any more, or Associate Chief Tynes, do you want to add any more to that in terms of behaviors that we should be adhering to post-vaccine?
I agree with what Dr. Holmes said. I think that was a great summary. The other thing I want to say is that the more people are vaccinated and kind of adhere to the exact guidelines that Dr. Holmes was talking about, avoiding those big groups and big gatherings, the more we can get ahead of this thing, get herd immunity, and the more we'll be able to open things up. And then, so it's sort of like the more we can do that, hopefully things will continue to open up, particularly for those who are vaccinated, but potentially for others too. The other thing I just wanted to go back and add one point to all the excellent points that Associate Chief Rose-Tynes and Dr. Holmes made about the Johnson & Johnson vaccine, which, one other thing is that at the end of the day, the things we care about most are deaths from COVID and hospitalizations from COVID. And those three vaccines are all essentially 100% in preventing those things. And that to me is amazing. And when I heard and learned that, and also learned that Johnson & Johnson was tested in South Africa with a much more diverse sample, which I really appreciate, because as a researcher, I know that there are always room to improve in the diversity of our samples in research, and that's a real problem. And so I really appreciate that. So kind of hearing that basically all three vaccines are 100% at preventing death from COVID and hospitalizations from COVID, to me, I'm like, I would take whatever was given to me as soon as possible. And, a parallel that some have made is that with the flu vaccine, you don't really know who made it, you just kind of get it. And so we're sort of in this unique position where we know the manufacturers of COVID vaccines, which we don't for other vaccines. And so in a sense, I would just take whichever one, because really we need to prevent those deaths and we need to prevent those hospitalizations. The more people we can get vaccinated, the sooner, the more likely we are to open up and go back to a society that, doesn't have quite so many restrictions in place.
Associate Chief Rose-Tynes, did you want to add any more to that?
Yes, I would love to add that we should not have this false sense of protection. Although we are getting vaccinated, we still have to concern ourselves with the variants that are out there. I think it's important to continue to message that we still need to be vigilant we cannot get relaxed right now. We are still in the midst of a pandemic. And yes, restaurants are opening up. You can go to gatherings with 100 people in a building now, and all of these things are opening. And I think it gives people a false sense of protection, and people can let their guard down because, well, you know, the state said we can open up this, that, and the other thing. We must be safe, but we are not there. We are not even close to there. So I just want people to still wear your masks, wash your hands, socially distance. We're not there.
Thank you. And yeah, we were noticing people, Vice Chair and my co-moderator, Ms. Bowman, was very good about getting it out, and I sent it out by text. And so a few texts came in, and one of them were, a few questions came to me through my text. And it was, is it safe to travel on a plane after vaccinated? Any thoughts on that? Does anyone want to opine on that at all?
I would love to jump in there. I just did some research regarding traveling on planes. So the airplanes have a great air exchange. Most of the newer most of the airlines, they have great HEPA filter systems in the planes. They have, some of them have 15 air exchanges per hour. I mean, our school buildings, a healthy school building has 4 or 5 air exchanges per hour. So imagine 15 in an airplane. The real problem with traveling on planes is the airport. It's when you are, going through security, when you're checking your luggage, when it's going through, the scanners. It's when you're that close to other people that they're saying that's the dangerous part of travel. If there was to be a certain time within you're traveling. The other part of it is, people on the planes, they're wearing their masks. You will see a lot of people are like cleaning their areas with hand sanitizer and Lysol wipes, and that's all well and good. But just remember, it's what's happening inside of the airport that you really have to be concerned with.
One other question that came up is, how soon after I received my second dose of vaccine will I be considered to have reached full immunity? Dr. Khan, Holmes, Chief.
2 weeks. It's 2 weeks after the second dose, if it's a 2-dose regimen, or 2 weeks after the first dose if you get the Johnson & Johnson.
Thank you. And then the last one, and then Sister Bowman, Vice Chair Bowman, I'll turn it back to you. Says kind of goes back to what you said, Associate Chief. It's like asking a person who you voted for. You talk about taking the vaccine. Have any of you? So I'll start with myself. I went and had the first dose, and it was Moderna, I believe, and that was about 3 weeks ago, and I'll have my second this Friday. And we started, this was a road for us. The road was two-pronged. One was, what do you think? And this was prior to it being available. Should we do it? Should we not do it? Is it a good idea? Is it not a good idea? And we really talked about it a lot in my family. And then we finally decided, and in part, my daughter was one of the deciding factors. So she's a teacher and she has to go back to the classroom. And so she didn't want to go, when she really thought about it, she did not want to go unvaccinated. And so she said, and we'll go together. Going wasn't easy. Trying to get a test date was more of a challenge than discussing it in our family, but we finally did. And again, we'll go for our second one. So I don't know. I turn to you, my Vice Chair and co-convener. Do you want to talk a little bit about your own experience in your family? I personally believe I can't sell something I'm not willing to do myself. And that's why I was willing, as a leader in the community, to say, I've done it, I'm still standing. And I feel a lot better having done it. But like Dr. Holmes and Khan and the Associate Chief have all said, I'm not going to relax any of my procedures or protocols, because I don't know who else may have been. People don't have a little button saying, I'm cool, I've been tested, that kind of thing. So back to you, my co-convener, Ms. Bowman.
Yeah, no, more than happy to talk about my experience. So in the first phase of the vaccine rollout, it was announced that clergy were eligible. They added it in right at the end of that time period. And some people know this about me. I'm also Reverend Bowman, in addition to all the other hats that I wear. And so I actually went back and forth about whether or not I should do it, not because of whether or not I thought it would be effective for my health, but the trade-offs of perceptions and, I mean, oh God, the fights we've been having in the context of my role as a school committee person. And so I decided to do it. Some people, look at our school committee meetings and they see sometimes we're virtual. We've been doing a hybrid model the whole time. So I've been going into buildings doing the service of a school committee member throughout this entire pandemic. And I did that as a working mother in addition to a full-time job. And so I thought it was important. My husband pushed me. He was like, it's available to you for a reason, get it. And so I did. As I mentioned earlier, I, was a little hesitant because I was a nursing mom. I'm still a nursing mom. But I know that, it's funny when you first give birth to a child, they tell you that breast milk is like the answer to everything. Like, if they fall, just put breast milk on it. If they sneeze, just put a little breast milk on their face and near the nose. It's funny. Like, it's literally the answer to everything. And so I just made the decision that I thought that if I did this, it would be another layer of protection for my child. And she's so young, and I just wanted to give her a chance. And so I'm glad that there's now research showing that decision that I made personally, that there is some data that backs up that decision, and that will help other parents make a choice for their family. And so I did get it. I did feel the effects of it. The first one wasn't so bad. The second one, I needed a day to recuperate from it. So yes, I did it, and I definitely encourage others, even in my own family, if we want to get really personal, I will not name names, but, I have these debates with my own family members around the value of getting this. I have family members that have not met my children yet, or my newly born child. She's a year now, but I want to make sure that my child, who probably has a higher probability of not being impacted by COVID, don't harm an older member of my family. And so that's a burden that I carry for her and my children. And so I really want to emphasize the importance and the value of getting this vaccine, because it's not just about me, particularly the fact that I'm a younger woman, or my children are, children. It's about the community. It's about our families and keeping us all healthy and whole.
Thank you. Anyone want to talk about that at all in terms of how it's, in their family?
Yeah, I would love to talk about my family experience. So I got the vaccine at the end of January because I'm work for a hospital. And I actually was a little ambivalent about that because I don't actually see patients. So first, patient-facing clinicians were vaccinated, and then they let the rest of the hospital employees get it. And I was thinking there are other people that need it more than me. But various ethicists says, if you're offered it, you should take it. So I took it. Then I had two experiences with family members. One is with a family member, and goes back to the conversation about pregnant women. One is a family member that is really looking to start her to have a baby. And she was reluctant because she had heard stuff about it affecting your fertility. And I convinced her, I said, that is not proven. But what is proven is that pregnant people have worse outcome of their pregnancy if you get COVID while you're pregnant. So please get the vaccine before you get pregnant. And then now we know that she can pass on the antibodies to her baby too, which is so it's all good. The other was the experiences when my husband became eligible for the vaccine. The access to it was horrific. We got on to that website the day he was eligible, and I will tell you, the two of us spent 10 person hours scheduling his appointment. He went on Friday. He had his second vaccine on Friday. He went to Fenway Park, and he said, Michelle, he said, both times he went, he says, I was the only Black person at Fenway Park. He said, 200 people. He says, not only was I the only Black person there, I didn't see any Asian or Latinx people neither. He says, so, I mean, just thinking about all the privilege that we had to be able to do that. We have great broadband. We have 2 computers. We work from home so that when one was having a meeting, the other one could be on trying to schedule the appointment. There was so many levels of barriers to getting that appointment that it really brought home to me why we see these incredible racial disparities in getting the vaccine, getting access to the vaccine. So those were my 2 experiences in my family.
Anyone else want to speak on this? Because we do have one more question in the chat that I can ask.
Yeah, I just wanted to say that, you know, Dr. Holmes, that's such a poignant story. And in my own experience, you know, people get such a bad rap about just that there's mistrust and vaccine hesitancy. And yes, there's some of that, but a large part of it is just the access, like you're getting at, Dr. Holmes. Like, you know, I'm on these lists where people are talking about how they came up with this computer algorithm using XYZ computer program I've never heard of to basically mine the state to figure out the right, you know, to get an appointment. And I don't know how to do that. I sort of feel a sense of, like you guys were kind of alluding to, guilt and privilege, because for me, it was very easy to get a vaccine. You know, I work for Boston Children's Hospital, and they did a fabulous job of scheduling it. It was a well-oiled machine, and I'm so grateful for that. But I realized that if I didn't, it would have been a whole other story. And when my husband becomes eligible, I know it's going to be, you know, a whole other story. The other thing I wanted to share about my own vaccine experience is I know there's people have talked about allergic reactions with the vaccine. And I have a history of an anaphylactic reaction to IV contrast. When I got a CAT scan, you get IV contrast, and it turns out I was allergic to that. So I actually needed to get an EpiPen and stuff. That was probably about a year and a half ago, 2 years ago. So I was a little nervous when I went to get my shot, because they talked about people with a history of severe, you know, allergic reactions, especially to kind of like IV stuff, which is what happened to me. You know, they might be at risk for allergic reactions with the vaccine. So I took my albuterol inhaler, I took my EpiPen. I was going to Boston Children's and knew that all that stuff would be there, but it kind of made me feel better to have that in my bag. So I went with all that stuff. And after I got the vaccine, I was like, I felt this lump in my throat, and I was like, oh my God, am I anaphylaxing? And, you know, I was sitting there, I told them, hey, I've had this reaction before. I don't know if this is just in my head or what. And they said, all right, well, we'll keep watching you. How are you feeling? They kept checking in on me. And, you know, after about 45 minutes or so, nothing was happening. And I went home, and I kind of had that EpiPen near me the rest of the day. When I went and got my second shot, 3 weeks later, I started having that feeling in the car on the way there. So that's how I knew it was in my head. I was like, okay. And I started talking myself down. I was like, okay, you're feeling that lump in your throat. It's just because you're anxious. And I kind of talked myself down. I got the second shot. I had my EpiPen in my bag. Nothing happened. And I realized it was just kind of me being anxious about it. And, so that anxiety is real. And I was thankful that it wasn't a real reaction, but I definitely was kind of prepared and a little anxious and kind of on guard, but it all worked out in the end. I agree with Vice Chair Bowman. After the first shot, it was like a little sore arm. It wasn't a big deal. After the second shot, I definitely was lying on the couch moaning for an afternoon, and it was better the next day. But, that made me happy, because I knew that, that's just my immune system reacting and making those antibodies, and hopefully making me more protected if I were to be exposed to COVID. But I wanted to share kind of that anxiety and that allergic piece that ended up being just fine.
You're on mute, Denise.
For sharing that, because the more we can get that information out, we can release the fear, or reduce the fear that people have. As someone who doesn't take Tylenol or anything, I have to have a headache so severe I can't stand up straight before I'll take anything. I can understand that if you get yourself worked up into a lather, it makes everything worse, and then you might need something like that. So I want to thank you both, and I'm going to turn to the Associate Chief to see if she wants to add something. Those personal stories, I think when we share that with people, it helps reduce not only anxiety, but helps people get there. And before I turn it over to you, Associate Chief, there's something you said, Dr. Khan, about anaphylactic. One of my family members that is very reluctant to get it has autographia and allergic to everything, the oddest things, bananas. How does that happen? But so she's saying, well, I'm taking this medication for X right now, and I'm breaking out in hives. And so she's sort of in a panic that if she does the COVID test, the same thing will happen. Any thoughts around people that have those sort of high response, allergic responses to just about everything, or strange things that they should do, or should they not worry about? Should they talk to their primary? What would you recommend?
I would definitely recommend that they talk to their, primary care doctor, and if they have an allergist, their allergist. I will say those allergic reactions are exceedingly rare, very, very rare. Probably have more people having what I did, where it was me just being anxious, right? But, it can happen. And so, if people have severe allergies to the point where they carry an EpiPen, they can certainly bring their EpiPen with them and, kind of monitor. But I will say that the vaccine administration sites do a really great job of having you sit there and be observed for, 15 minutes. At Boston Children's, it was 15 minutes for everyone. And if you have a history of allergic reactions like me, then it was 30 minutes that you got observed. And the vast majority of those reactions are going to happen in that time period. So I think, talking to your care providers, bringing that EpiPen if you carry it, and then, just kind of trusting that you're there and you're going to be observed. And also just knowing that those are really, really rare reactions. And what is not rare, sadly, in the pandemic is getting COVID and getting really sick from it and getting, and dying from it. So it's also kind of like a balancing the risks and benefits, and like also the probability that you will have something. And to me, the scariest part is getting COVID, giving it to a loved one, things like that.
I know that we're getting close to the end of the hour. The conversation has just been so robust, and I'm so grateful that each of you decided to join us today. I want to turn our attention to, the conversation. I just feel like it's been a heavy conversation for our community, this whole school conversation, and it has really ripped us apart, quite frankly. And it is wearing me down, if I can be transparent and honest about that. But, we're going to have educators and staff, educational staff be vaccine, but our children will not, right? And so there's going to be a time lapse between those two. How should we be thinking about the school environment and parents as well as educators? I think the conversation to this date has really leaned more towards adults and what they need as it relates to being able to function within a school system. But we know an educational system is made up by a larger ecosystem that includes children as well as adults. So can you talk to us a little bit around how should we be thinking about our behavior in the context of schools, but not just schools, when it comes to restaurants and any place that we have to go that's an extension of our lives? So how should we be behaving over the next couple of months until our young people and children have full access to this vaccine?
I think we have to maintain these very strict mitigation strategies. We can't loosen up. We have to, the behaviors that we see, sometimes there are things that we're doing out there that will put ourselves at risk for COVID-19. And, we hear about things, we see things, and it can be frustrating, but all we can do is keep educating and keep reminding people we're not done. We're still in the midst of it. I think that the children, they need more. Dr. Khan, you would agree, you talk about it all the time. The mental health needs of our students are great. It's, those kids who've been remote for a year, they have needs. The kids who have been in school, the little ones, they have needs across the spectrum. I think we have to be really keyed into that. And I think that all of the behaviors, eating lunch together, you know, going to restaurants, we just have to just stay the course right now. I know I sound like a broken record, but that is really what is going to get us out of this. And I think it's just important to keep reminding whoever we can remind, keep pushing it forward.
Yeah, thank you, Associate Chief Tynes. Dr. Khan, your thoughts?
Yeah, I agree completely, Associate Chief Tynes. I think that, you know, in a sense, we focus so much on what's happening in the schools that we sometimes forget about the outside the school. And I think I completely agree. We need to be really careful about those small gatherings, about that indoor dining. We need to make sure we're masking and socially distancing. We got to, you know, be careful about avoiding those, you know, indoor play dates, things like that. And we need to get as many people vaccinated as possible, because kids can't get vaccinated yet. And the way we can protect our kids and eventually, hopefully, return to some semblance of normalcy is to get more people vaccinated and to get ahead of this pandemic. And so, you know, I think that's what we can do, is really protect ourselves by getting vaccinated, be really responsible about the out of the school behaviors and masking, hand washing. And then, you know, and also when we're in the schools, you know, keep those 3 feet social distancing, keeping on wearing the masks. And, you know, people have been doing such a great job. I've been so impressed, and my fellow pediatricians talk about this all the time, about how kids just completely blow us away with their ability to comply and do such a great job with these masks. And it's just such a pleasant surprise. And it's, the masking isn't the big issue on the mental health front. It's the isolation and the screen time and, you know, the effects of the pandemic on the family structure, on, you know, food insecurity, on working, on all of those things. And so the more we can vaccinate, the more we can, you know, comply with those, I think the more we can protect our kids who can't quite protect themselves yet.
Dr. Holmes, your thoughts?
Yes, I agree completely with my colleagues. And I just wanted to add one more factor that we haven't talked about. I think many times people minimize impact of this disease on children. However, we now know that many adults and children can suffer from long-term effects from this disease. And so it's really important, I will echo for the third time, that we protect our young people while they can't get vaccinated, because it is not a benign disease for children. Some children die from it, and they've been disproportionately children of color, and some children go on to have long debilitating effects, and we don't want to see that happen to any of them.
No, I appreciate you saying that. And I, you know, this whole conversation around children and schools, it's been really heavy, and people, you know, respect all the different perspectives. And what I do know is that children have these serious needs, and as much as we can continue to talk about what those various needs are, it's so important, because we have to protect them. They don't have the ability to vote. They don't have the ability to have these types of conversations, particularly younger, like, you know, teenagers have a bit more agency, but, you know, kids that are, you know, Dr. Khan's children age or my children age, they just don't have the level of advocacy needed in these conversations. So we represent that. I am just really elated that we had this conversation today. I want all of you to come back. Can you come back again and do this with us? Is that okay? Can I get that commitment? So I'm going to hand it over to my co-host, Denise. Any last thoughts before we head out for this afternoon, so we can enjoy this beautiful spring day?
Thank you. I'm sorry to end the conversation just as I feel like there's just so much more to say, particularly around children and their mental health, which we didn't kind of have that real deep dive. You know, how the whole just being isolated and only online and not being able to go out and play and interact. And something that really touched my heart that you said, Vice Chair Bowman, when you said there are relatives that have not seen my new daughter, you know, and it's hard to fathom that. And so I hope that we can continue to have these conversations, inform people how to stay engaged, to stay healthy, not only but their mind, their body, and not only their body, but their mind and their spirit. So I stand with my co-host to saying, please come back and let's talk some more. A very, very special thanks to our Associate Chief Tracy Rose-Tynes and Dr. Alisa Khan. And Manikka and I always get in trouble. So you come from Boston, but we're just going to snatch you over here to invite you over again. We're not going to let the borders be what stop us from having robust conversations. And of course, Dr. Michelle Holmes, who does so many things in the community to make time out of your schedule to be with us this afternoon, has been wonderful. I just want to take a moment to thank the staff of CCTV once again. Maritza Grooms and Sean Eiffel, staff from my office, Neil Alpert, and the new executive director, Jessica Smizer. What also to remind people, even though this conversation is ending today, that you'll be able to see it online in the CCTV archive. So if you missed some of it, you can come back in about a week or so and it will be online. You can also see some of our past programs that we've had, and you'll be able to know what we're going to be talking about in the future. So thanks so much for coming.
Yeah, and I just want to let everyone know before we go that we will be sharing information about how you can register to get access to your vaccine. So that will be up, and it will also be on CCTV's website as well. So thank you all. Enjoy this beautiful spring day, and Councilor Denise Simmons and we will be back, so stay tuned for more that we will provide from our Black Cambridge and COVID series. So thank you all for being here. Have a great day. Bye.
Thanks again.